I will move on now to talk about how formulation has demonstrated its usefulness in therapy. Good treatment outcomes have been found in interventions that have been guided by formulation. Persons and colleagues found that formulation-guided CBT for anxious depressed clients showed statistically and clinically significant changes in symptoms of depression and anxiety that were comparable to those reported in published randomized controlled clinical trials of empirically supported therapies for clients with single mood and anxiety disorders. Kirkland explored the efficacy of CBT formulations with 3 clients presenting with learning disability and psychosis and found that cognitive behavioral formulation was an effective method of engaging these clients to help them understand their problems and to find solutions to their problems. Formulation-driven interventions have also been found to be effective for clients presenting with severe disorders such as bulimia nervosa and psychosis. Although, as mentioned earlier, some clients may respond negatively to formulations, there are also clients who respond positively to formulations. Clients have described formulations as helping to normalize their difficulties such that they don't seem like insurmountable obstacles to be overcome. Clients become more hopeful that solutions to their problems can be found and that change is possible. Formulations have been lauded as helping clients to increase insight into their difficulties and as providing them with ideas for alternative coping strategies and not just seeing medication as the only solution. Clients also report experiencing the therapeutic relationship positively with therapists who practice formulation. And lastly, clients find written formulation materials useful as they can share these written formulations with family to explain the difficulties that they are going through or refer to these written formulations to help them keep track of their progress in therapy. Other than clients, therapists also experience formulations positively. They commonly state that formulations lead them to an increased understanding of clients as well as provides them with a clear direction for therapy. Therapists also report that formulation serves as a vehicle which enhances the therapeutic relationship with the client. The client is better able to engage in therapy when he or she senses that the therapist is able to understand and make sense of their problems. Formulations have also been suggested to be useful outside of the context of individual therapy. There has been increasing interest on the effects of formulation in multidisciplinary teams. The introduction of psychological formulation in multidisciplinary teams that consist of doctors, nurses, occupational therapists, medical social workers, etc., has led to the improvement of psychological knowledge and understanding of clients among team members. Members in these teams also report increased feelings of empathy for patients presenting with challenging behavior, and this has led to better staff-patient relationships. Formulation meetings in which team members get together to formulate problems have received positive reviews as an avenue that provides space for staff to discuss ideas and develop a shared understanding of the client, leading to better communication and teamwork. Clearly, there are several advantages to formulation, which is a cornerstone of clinical psychology. Formulation is to clinical psychology as diagnosis is to psychiatry. Formulation is also considered one of the core competencies of clinical psychologists according to guidelines established by the American Psychological Association, the Australian Psychological Society, and the British Psychological Society. Formulation is not only used in clinical practice, it is also strongly emphasized in postgraduate clinical psychology training programs, as can be seen by this statement from the Australian Psychological Society that states that the preferred model for clinical training is the problem formulation and hypothesis testing approach. Following this model, individualized treatment programs are constructed based on the basis of detailed psychological assessment and history taking, and a preliminary formulation of the problem, with the hypothesis to be tested. However, as pointed out by Hart and colleagues, there is no agreement concerning how clinical psychologists should conduct or evaluate formulations, although there is consensus that formulation is a core competence and critical aspect of daily practice. Recently, the Division of Clinical Psychology, which is part of the British Psychological Society, established a set of good practice guidelines on the use of psychological formulations, providing details of what formulation is and is not, issues surrounding formulation, and recommendations on how formulations could be effectively used with clients. While there are currently guidelines that have been established to guide the use of formulations in countries where the practice of clinical psychology is well developed, there is a lack of good practice guidelines, especially in countries where the practice of clinical psychology is relatively young. Singapore is one such example of a country where the practice of clinical psychology is not yet well established compared to that of other Western nations. Singapore is a cosmopolitan and developed city-state. It is a multiracial and multi-religious society with the majority of Singaporeans being Chinese. The values, attitudes, and lifestyles of Singaporeans are a mix of the East and the West. While classic Confucian values of collectivism, interdependence, familism, and hierarchy are still prevalent among many Chinese Singaporeans, with increasing globalization, Singaporeans are also beginning to adopt Western values of individualization. It is a fact that psychotherapeutic models and psychotherapy have derived mainly from the West, based on the clinical experiences and research of Western scholars and clinicians with Western, European, and North American clients. Hence, it is not known how these theories for understanding human behavior and the origins of psychological distress are applicable to people in an Asian environment such as Singapore, and how people from such a culture may experience therapy differently, since they may hold different values and beliefs from their Western counterparts. Devon found that Chinese Singaporean clients idealized the psychotherapist as an expert, which resulted in dependence on the therapist. Fu and colleagues found Singaporeans to be largely respectful of authority and suggested that a more directive therapeutic approach would be more suitable for these clients. However, these two findings stand in contrast with the principles of formulation, which is to encourage collaboration between therapist and client, instead of a top-down approach where the therapist is seen as the expert with all the solutions to life's problems. Given the differences between formulation, which advocates collaboration, and the expectations that Singaporeans have on psychotherapists as being the expert and the person in authority who has all the answers, one cannot help but wonder if these cultural differences lead clinical psychologists in Singapore to practice differently from their colleagues in the West. Specifically, how does formulation fit into the work of clinical psychologists in Singapore? Research into the practice of clinical psychology in Singapore is scarce, and research into how clinical psychologists practice will be useful now, as measures are being taken by the government to regulate the practice of clinical psychology. Research into this area can be useful in terms of providing suggestions and recommendations for good practice guidelines to inform clinical practice. This brings me to my current thesis project on the use of formulation in the practice of clinical psychology in Singapore. The aims of this project are to investigate how clinical psychologists in Singapore make sense of the client's problems, to identify how case formulation might currently play a role in the work of clinical psychologists in Singapore, and to examine the perceptions of clinical psychologists regarding the use of formulation in their work. As no research has been conducted in this area, and not much is known about how clinical psychologists practice in Singapore, the research was conceived to be exploratory in nature. The qualitative method was chosen as one of the advantages of utilizing a qualitative method